Hello, this is Dr. Tae, and today's episode is on ashwagandha. Ashwagandha, aka winter cherry, in TCM is called non-phase jia, and I wouldn't say this is a Chinese herb. However, this is an herb from India and it's considered the ginseng from India. This is one of those herbs that a lot of people have been taking in the last 10 years, and they always say it's good for a lot of those things. And yes, that is a lot of it is true, but I want to talk about what is really the centerpiece of it and what are peripheral, because herbs always has these main function and peripheral functions because of the main function. And if you look here, the Western approach and the Eastern approach. And in the Eastern approach, ashwagandha enters the lung, heart, and spleen. And the key action is that it tonifies energy. And because it tonifies energy, it's got the tonify Wei Qi, which ultimately is part of the lung Qi in the spleen, and tonifies Jing. Jing is the essence of who you are, meaning it's got the fertility component, right? And according to this, it builds immunity, strength, aids recovery, cold, coughs, heavy feeling in the chest, tuberculosis, poor appetite, diarrhea, poor memory, mental confusion, impotence, male fertility, um, insomnia, anxiety, stress disorder, and depression. Now, will I use it? The only thing I would use it for mainly is impotence, male fertility. So this is an herb that I would use it more towards men, not towards women. Can women take it? Yes. And I've seen so many women take ashwagandha for their fertility reasons. And yes, it does help, but there are better herbs for that. And I think this is one of the reasons why I want to, talk about herbs on YouTube. Okay. On the Western approach over here is also known as Indian ginseng, right? And it's an adaptogenic herb, means that it helps regulate your cortisol levels and is antispasmodic, anti-inflammatory, slightly sedating, nervine tonic, diuretic, nutritive tonic, thyroid stimulant, yes, and it's an aphrodisiac. Yes, there is a lot of research that points to increasing the fertility of men in terms of sperm count and virility. This herb, what I think it really does from a scientific standpoint is that the main mechanism of actions in the ladders appears to be based on a hypothalamus pituitary adrenal axis, basically your endocrine system, as a decrease in cortisol levels and increase in hormones such as luteinizing hormone and follicle stimulating hormone in men were found, which results in stress level reduction and improvement in fertility. In return, other studies prove that the substance from ashwagandha acting on the body causes an increase in secretion of T3 and T4 by the thyroid and subsequent decrease in the level of TSH, which is the thyroid stimulating hormone, in accordance with the pituitary hypothalamus pituitary thyroid axis. So this helps regulate your endocrine system, and that is the main function. And it focuses on adrenal axis. So your adrenaline gets pumped when you are stressed, right? And when people are stressed, for example, like I'm going to say first responders, like police officers or people in the military, they are put in a situation of fight or flight. This is an herb that would be really good for them. And those people who are facing anxiety, by fixing their adrenal thyroid axis, um, it would help them a lot because their cortisol levels are getting regulated. And because of that, your fight or flight stimulation has more energy to respond in a positive way where you're not so depleted. So if you are constantly under stress and you're not getting enough sleep to lower your cortisol levels, then that might cause some anxiety. Now, should people take ashwagandha because they have anxiety due to not doing their homework and you're stressing out during finals? No, the people who should be taking this herb is they're constantly under stress because their job. So this is the main reason that people should take this for. The other one over here is on well-being and sexual performance in males in randomized studies. In an 8-week program in a double-blind and placebo-controlled group, we investigated the aphrodisiac property of ashwagandha. 50 participants with lower sexual desires were randomly allocated of 300 milligrams of this herb, and the results were conclusion, these findings suggest that ashwagandha demonstrated a significant subjective perception of sexual well-being, assisted in increasing serum testosterone levels in the participant. So does it raise testosterone? The answer is yes. An investigation into the stress relieving and pharmacological actions of ashwagandha in a double-blind test study. The conclusions were these findings suggest that ashwagandha's stress-relieving effects may occur via its moderating effects of the hypothalamus-pituitary-adrenal axis. Like I said before, the people who are under constantly stressed and they're getting tired and they're not able to get the sleep, this helps you do that. So this would be a great herb for people who are in a high-stressed environment. And next one is clinical evaluations of the pharmacological impact of ashwagandha in root extract on sleep in healthy volunteers and insomnia patients. And the conclusions were ashwagandha root extract can improve sleep quality and can help in managing insomnia. Managing, meaning it's not that great for it. Will it help? Yes. Next is effects of an ashwagandha root extract on a climacteric symptoms in women during perimenopause, a randomized double-blind placebo-controlled group. Once again, this herb, according to this research of 91 participants that completed a study in comparison with the placebo group, there was an intake of demonstrated a statistically significant reduction and was also compared to the placebo group, which means this does help. However, should people, ladies in perimenopause, take this herb to help their hot flashes and night sweats? In combination with other herbs, it can help that, but it would be, once again, a very small population. So who would I recommend ashwagandha to? Ashwagandha is good for people who are in a high stress environment, and the stress is making them weaker, making them slow down, and that would really address those issues. For perimenopause and insomnia, yeah, I would use it as a supportive herb, but not as the main herb. Things like Romania would be a much better herb for regulating the signs and symptoms, because that herb gives women the body parts it needs to create the correct hormones like estrogen and things like that. And so I think ashwagandha is one of those herbs that have become widely popular in the last more than 10 years now. So many people are taking it. And some people are finding a lot of great things with it, especially for fertility reasons. And fertility, I think, I think it would help more on the men's side, but not on the women's side. Does that mean it will not affect women? The answer is no. It can do wonders for women. But once again, there are herbs for women that would work a lot better other than ashwagandha. Now, having said all of this, do I take ashwagandha? I think it's in one of my formulas that I make for what they call coffee tonics. And coffee tonic is a formula that I came up with for people who were taking drinking coffee all the time. And coffee stimulates your cortisol production in your kidneys and gives you that high. And it is a inhibitor of this hormone in the body, where this chemical compound helps them suppress the tiredness of your body. And then the more it accumulates, it gets rid of that. So people who drink coffee first thing in the morning, instead of taking coffee, they should be taking this blend called coffee tonics. I'll talk about coffee tonics in the future episodes. So once again, thank you for watching this episode. Please do not take any of this as medical advice. It's for education purposes only. And if you like the video, hit the like button, hit subscribe, and stay tuned for more videos. Take care. Bye.